As a resident of Jamaica, I decided to make short video series about 60 years of independence that the country celebrated this year. We all know about the global impact Jamaica had when it comes to culture, music, sports, and so on. But hardly anyone knows or talks about how much contribution Jamaica made to the world healthcare system. This was one of the biggest surprises I had while doing the research for this series, so much so that here comes a separate episode dedicated to this topic alone. So, Jamaica, healthcare system, and the contribution independent Jamaica made to global health during the last 60 years. This video is sponsored by you. Thank you so much for the support. In part 1, we spoke about the influence Jamaican culture had on the world. Part 2 was about living conditions, including the most necessary services and housing. If you haven't watched those videos yet, please check them following the links here and in the description below. This is episode 3, and before we discuss all the contributions of Jamaica to world health, we shall start with how modern Jamaica compares to other countries when it comes to healthcare. There are hundreds of ways of how you can evaluate and compare healthcare systems. For instance, we can look at the number of health facilities available for population, but that wouldn't tell us anything about the quality of these health facilities. And how do you even evaluate the quality in this case? So for this video, let's look at the well-established facts and the results we can track, which are the main pillars when it comes to population health status. First, there is a global concept of free healthcare. It doesn't mean it's actually free. It simply means that somebody else is paying for it, like the government or other people's taxes. But free healthcare means that all citizens receive healthcare without having to pay for services. There is another global concept, universal healthcare, which means there is a healthcare system that provides coverage to a high percentage of citizens. How high? Well, some analysts suggest it's 99%, others say it's about 90%. If you look at this map, it shows that majority of countries offer free and universal healthcare, while some countries like Egypt have healthcare that is free but not universal, or universal but not free like in the US, or neither of these things. Jamaican healthcare is universal and free to all citizens and legal residents at public hospitals and clinics. But at the same time, Jamaican system involves a mix of public and private sectors. The public sector is the primary provider of public health and hospital services, while the private sector dominates ambulatory services and the provision of pharmaceuticals. At the moment, there are about 300 health centers, 24 public hospitals, and numerous private ones. If you look at the results of the work of Jamaican healthcare, the statistics of the last 60 years, you will see that overall, Jamaica made significant achievements in improving the population health status. Here is the data. When Jamaica became independent in 1962, life expectancy at birth was 65 years, but it increased to almost 75 years by 2022. Another important progress was in the infant mortality rate, with numbers falling sharply from 57 per 1,000 live births to 11 by 2021. But of course, not everything is getting better in Jamaica when it comes to health. Currently, 1 in 2 Jamaicans are obese, 1 in 3 have hypertension, and 1 in 8 have diabetes. But at the same time, Jamaica is also known for low alcohol consumption rates, and as a result, alcohol use disorders are 1%. The percentage of tobacco smokers in Jamaica is rather low too. And despite the image promoted, especially by foreign media, the consumption of illicit drugs in Jamaica is also low. It doesn't mean these issues don't exist. Of course they do. It's just that they are not at such high level as in many other countries. It is important to bring attention to these issues and fight these problems, but it's also important to view them in the global context to avoid falling for stereotypes or misinformation about Jamaica. Some of the characteristics of how Jamaica did in these 60 years when it comes to healthcare can be viewed in this table with the Global Health Index. And Jamaica is ranked 82 out of 201. As expected, this is not as great as Canada, which is number 10, or the UK, which ranks 27, but just slightly better than the United States, which ranks 84. And the reason for the low ranking for the US health system is not because of the quality, it's because it's not free. I show comparison of Jamaica to these particular countries not because there is something special about them, but simply because most of my viewers are also from the US, Canada, or the UK. Despite all of these relatively good ratings, if you live in Jamaica, you would hear from the locals that there is a lack of hospitals, or that it can be difficult to get through to a specific doctor because of the waiting lines for appointments. And overall, there are people in Jamaica who are unsatisfied with how Jamaican healthcare system works. The reason for that is because for many years, the funds allocated by the government to the public health sector were simply not enough to keep the service at the highest possible standards. There was a lack of manpower, equipment, and so on. Obviously, I'm not an expert in medicine, so the details of how the hospitals and health centers work, the challenges they're going through, and what is currently being done to improve healthcare will be shared in a full documentary that I'm making together with Jamaica healthcare institutions and medical professionals. I also want to find out from them how the locals can make sure they're taking a full advantage of free public healthcare, as well as how they can benefit from private healthcare and how to make it affordable. So please, don't forget to subscribe and hit bell notification not to miss the video when it comes out. And also, if you're enjoying this video so far, don't forget to give it a like so YouTube algorithm would understand that the video needs to be recommended to more people. Now let's look at the contributions that independent Jamaica made to the global healthcare system. There were actually quite a few, but I've selected 3 major ones to share with you today. If you look at the information of the World Health Organization about Jamaica, you will find the following. Jamaica has a long history with primary healthcare and made a notable contribution to the Declaration of Al-Matar by presenting its experiences and helping to shape it. If you don't really know what exactly this primary healthcare is, where it comes from, or anything about the Declaration of Al-Matar, you would have no idea what this statement even means, never mind why it is important. So, if this is your case, you are just like me, and we're both in for a big surprise. It turned out that until 1970s, healthcare system in the world was going through a lot of issues, especially in the so-called developing countries. Here is the oversimplified explanation of what it was like. There could be one hospital with some top specialists all clustered in one place, like in the capital of a country. And even if you had some minor issues like regular cold, you would have nowhere else to go for medical assistance but there. And of course, a lot of people didn't go because too far, travel expenses, and so on. What is more, highly qualified general practitioners and other doctors could usually be found in urban areas only, while people in rural communities had no medical help whatsoever. And even if you were lucky with doctors being next door, their services were not affordable for average people. In short, lots of people all across the world had no access to any healthcare at all. In order to solve this problem and implement a brand new healthcare system that would be open for everyone, the countries agreed to meet up at the international conference in 1978 in Almaty, which is a city in Kazakhstan. And that's where they adopted a document known as Almaty Declaration. This declaration was a major milestone of the 20th century in the field of public health, and the new system that was adopted is still being used today. This system is called primary healthcare, and it became the key to attaining the goal of health for all. To understand what exactly happened, let's look at the concept of primary healthcare. It is rather complex, but most important points are the following. One is that it's focused on prevention rather than cure. And two, it involves the local community. The whole idea is that instead of going to this big hospital or very expensive doctors, people can simply visit somebody who lives nearby. These local medical professionals are not being of top skills, but they don't need to be, because they can still advise what to do with typical health issues or notice early if a health issue is serious and needs to be addressed elsewhere. Basically, primary healthcare does what the name suggests. It's your first point of contact with healthcare system. The result it had is the incredible accessibility. So a lot of health issues were prevented or treated at the very early stages. As you can imagine, changing the whole attitude to how healthcare should be provided and making it accessible to everybody and not just to a tiny percentage of lucky or rich people, it was an important task, and it was achieved only because of the work of a lot of people and organizations from all sorts of backgrounds. So, what does any of this have to do with Jamaica? Well, everything. Because Jamaica was one of the rare countries that had already practiced primary healthcare before this concept was given an official name and introduced everywhere else. Al-Matar Declaration for the World was created with the help of the document that was developed and put together by Jamaican health professionals. It was Jamaican professionals who showed Jamaica as a successful example of how primary healthcare system works on the island. Then the system was put out by World Health Organization as the overall goal that other countries had to follow. That's how Jamaica directly contributed to global health by doing the research and providing the proof from their own experience that primary healthcare system works really well. If you wonder, how did Jamaica have this health system before anyone else? It's a long and interesting story that will be discussed in that other video about healthcare. Jamaica holds the record in immunization. It is through this focus on primary health that the country has been successful in implementing a stellar immunization program. It has resulted in the elimination of the number of vaccine-preventable diseases, which is the reason why infant mortality reduced. Through the expanded program of immunization established in Jamaica in 1977, Jamaica has made significant strides towards attaining universal immunization coverage for all children. Jamaica was able to successfully eliminate poliomyelitis in 1982, measles in 1991, and rubella in 2000, while the last case of congenital rubella syndrome was recorded in 1998. The expanded program on immunization is executed by the Family Health Unit of the Ministry of Health and Wellness of Jamaica. It is internationally recognized that Jamaica has been among the most successful in terms of immunization coverage, and Jamaican program has been used as a benchmark for other countries. There are people in the world who are against vaccines, including some people in Jamaica. And I know that some are even watching this channel. Because of the COVID-19 pandemic, it became apparent that a lot of people don't really understand even the basics of immunization, how vaccines are developed, how they work, and so on. People with best intentions were spreading some of the most ridiculous posts that wearing masks can be dangerous for you, completely ignoring the fact that all doctors wear masks during their work throughout the whole lives and nothing happens to them because of that. Or that vaccines have side effects, ignoring the fact that all medicine has side effects, even the most natural herbs. Today, 2022 is now ending. 12.7 billion shots of COVID-19 vaccines were given throughout the world. We can finally see the results. The number of people dying from COVID reduced drastically, meaning COVID vaccine does precisely what it's supposed to do. It saves people's lives. Maybe if people knew that the first vaccine was developed in 1798, and that's in Europe, while China practiced vaccination even before that, they wouldn't be so concerned. Because after all, Bill Gates didn't exist back then, neither World Health Organization or any other scientists who are alive today. Throughout history, immunization helped to fight a lot of diseases and completely eliminated some of them. Jamaica is one of the countries that proved in practice that immunization works and saves lives of children. So for people who think that vaccines are evil, how do you explain something like this? That in 1988, all of these countries marked red had polio. Then vaccine was introduced, and by 2014, there was no more polio. And before you say all of this is fabricated, remember that polio has physical effects. Just Google to see what the effects look like, and then look around you and say how many people you've seen with polio in the last 30 years. And if you did, were they vaccinated? I really want to know, because if not for the vaccines, how do you explain what happened to poliovirus? Dental treatment is expensive, and the costs of treating caries mount with the progression of the disease. In the 20th century, in many so-called developing countries, treatment was unavailable because of the shortage of dentists. It is in such settings where the prevention could make the biggest difference. You see, there is a natural mineral called fluoride that is released from the rocks into the soil, water, and air. If the levels of this mineral are high enough and teeth are exposed to it on a regular basis, it can prevent tooth decay. All water contains some fluoride in nature, but usually the levels are not high enough to have any effect to prevent tooth decay. But there is groundwater and natural springs that can have naturally high levels of fluoride, and such water can be very useful for your teeth. Today, there are many ways, including the cheap ones, to get fluoride and deal with tooth decay problem. For example, fluoride is added to the modern toothpaste. So if you brush your teeth properly every day, you're good to go. But this wasn't the case back in the 20th century. For example, in Jamaica, only 2.8% of young children had no dental problems, while all the other kids were struggling with some form of tooth decay. A lot of other countries had similar statistics. So in 1950, Switzerland came up with an idea of fluoridation of domestic salt for human consumption for the prevention of dental disease. It was considered a valid approach based on experiences of fluoride in the prevention of dental caries. Jamaica made history in the 1980s when salt fluoridation of the domestic water supply was introduced, and it became one of the country's most important public health achievements because it contributed to the significant reduction in the levels of tooth decay in children. Here are the results. The percentage of children caries-free just before the start of the program in 1987 was 2.8% for 12-year-olds and 0.3% for 15-year-olds. By 1995, the percentage of caries-free children was already 61%. Many Western European countries opposed to salt fluoridation of domestic water, stating that water shouldn't be medicine, it should be just water. And if we need salt fluoride, we'll buy it or go to a dentist. But the United States followed the practice, and in fact, the US Centers of Disease Control added water fluoridation as one of the top 10 public health achievements of the 20th century. Through its impact on the health and well-being of children from low-income households and the demonstration effect that influenced other countries in the region, the Jamaican fluoridation program shows how much can be achieved with focused attention and creative problem solving. This video is about healthcare and medicine. That is, of course, the subject of science. And the video wouldn't be full if I don't provide the context and add a very short but an important note about chemicals. This is because I know that many people want to focus on everything natural and worry about chemicals in water or chemicals in food. So, I'd like to remind everybody the definition of a chemical. Chemical is a distinct compound or substance, which means water is chemical, air is chemical, In fact, there is nothing more natural than a chemical because all our life consists of substances that scientists call chemicals. Most of my viewers always add chemicals to their food, at least this one, sodium chloride. It's just that we don't use the scientific name for it and instead call it salt. But of course, there are naturally occurring chemicals and there are artificially created chemicals, synthetic substances. So in most cases, when people worry about chemicals in food or water, they don't mean salt. It's more about the artificial ones, because they want all things natural. But the problem is, of course, not everything natural is good for you. Some can kill you. For instance, sulfur dioxide, which is naturally released into the air by volcanic activity and can naturally kill plants, animals, and sometimes humans. Not all artificial chemicals are bad for you. For instance, sodium hypochlorite is an artificially created chemical that kills natural bacteria so that natural bacteria doesn't kill you. I'm talking about bleach, of course. All I'm saying is that there is much more to the subject of chemicals than simply viewing them as something good or bad. And I thought it was a good idea to end a video about Jamaica's contribution to science, like medicine, with this food for thought. Thank you so much for watching. If you have found this video useful and learned something new, please share it with others and discuss with your friends. I would also like to know what you think about the video, so please share in the comments below. And the special thanks are always to our patrons for their continued support. If you also wish to join them and add your contribution to this project financially, you can do so from only $5 per month. My name is Irina, and I'll see you in the next one. Bye for now. Dioxide. Fluoride, hypochloride, sodium hypochloride, poliomyelitis, poliomyelitis, congenital rubella syndrome, immunization, immunization.